One second, please, let's turn the recorder on.
Okay.
Okay, it's 9:31. We will call this work session to order. This is our regularly scheduled work session. We've been in the habit of having a work session every couple weeks ahead of our regular formal board meeting where we can just talk a little more informally. We are very thankful to have the EMS coordinators with us here today, at least a good number of them. We just want to make a few opening comments, and we're going to let you guys kind of run the thing here. We do appreciate, on behalf of the commission, welcome. We do appreciate what you do for us here in Seneca County. We don't thank you enough, and thank you for what you do. We appreciate you leading us today in a conversation about the direction of EMS services here in Seneca County. As I told one of you before, we should have had this discussion probably a couple years ago or more, but we didn't, so we're going to have it today. The commissioners are here to listen. We're not here to do a lot of talking today. You guys are out in the field. You know where we're at and what needs to be done. So I guess we want to hear where the status of EMS is, where do we need to go from here, and how do we get there. I'd also say don't be afraid to say anything. This is an open, this is a session where we want to get it all on the table. So if you're worried about offending us or somebody else, don't worry about it. Say whatever needs to be said. And then once we get all the info out there, we'll kind of come to some sort of a direction hopefully after that. Either of you guys have any comments before we open it up?
I was just going to say, it's going to be extremely helpful. I mean, I know in the process of getting to these positions, we've, go through the learning curve and all of that, but now even that curve gets a little sharper. And so these work sessions we've had with different entities and services of the county have been very helpful to myself, and I'm sure Fred agrees as well, just to names and faces as well as just what's going on and get an update of where things are at. And regardless, sometimes you hear a lot of history when you're out and about, and that's not irrelevant, but yet it's important what's going on now and how we can make a difference and continue to provide great services you've been doing. So
the only thing that I would add is the commissioners we have put together over the last 5 years. I wanted to look at a high level, income or revenue, shall we say, and expenses. How have we charted that over the last 5 years to be able to support EMS and to keep EMS with new vehicles. And even though there has been a constant decline in local government funds, the commissioners have kept their level of support at the same level, and we can see that the income is slightly above what the expenses have been over the last 5 years. So I think that overall you guys have been doing a good job of managing it. I think, again, income, and that's really from a business perspective, that's what I look at. What's the income, what's the expenses? You look at over a 5-year period, and it appears to be sufficient, but maybe not from a practical standpoint, yes, but from an operational standpoint, there may be issues here. And that's what we're open, to hear everything. But again, I just want to let you guys know that the commissioners, we've taken a proactive approach to this, and let's see what the last 5 years were. So that gives us a basis to at least start from there.
Okay, anybody wants to say anything? The only thing we ask is you state your name, because we are recorded and they can see us on camera, they can't see you. So if we play this recording in a month, we won't know who said what. So if you just say your name before you state it, if you can remember, if you forget, well, it's no big deal. Yeah, it's done.
Everyone start. Don Kelbley, EMS Director. I think there are two issues that we have. One is our resolution that was created 3 years ago is going to expire at the end of this year. That's the $155,000 that Commissioner Zoller was talking about as far as funding EMS. The other part of our income is just strictly from patient transports. And we go on the Medicare slide where, and other insurance companies are also doing it. If we take, like, for example, a $500 ambulance transport, if we take a patient to the hospital, Medicare say, well, our allowable amount is $380 and we'll take 80% of that. So already we're behind the revenue curve as far as we're not getting dollar for dollar for our expenses. Expenses have gone up. The fuel, as you know, diesel fuel is at right now anywhere between $4.09 and $4.19. It's been staying that range for a long time. All of our 10 ambulances are diesel vehicles. We only have 3 vehicles that we have other than the ambulances that are gasoline jobs. So that's the one part on the financing. The other part is our personnel has been declining. There's a lot of, like for instance, this morning, we have 3 squads out of service for lack of personnel, which we still have 4 in the county. It's just now that we're taking in a bigger part until about 4 o'clock, 5 o'clock, and then 6 o'clock when each one of the squads come in. So we can attribute that to a lot of different things. The biggest thing is training. The 3 different levels we have as far as EMTs, advanced EMTs, and paramedics all take anywhere from 40 to 92 hours every 3 years. We have school districts have moved to different locations, so you're not able to be on call now because you got to go get your child at school after track practice or whatever is going on after school. The other thing is we're just involved in so many different activities that you have to prioritize what you need to do as far as we want to support family, but we got to support the community. Even the fire side is having some difficulties. There's maybe 1 or 2 people responding on a fire truck on a call. So being a volunteer today is very it's free gratis, but it's also a reward back to the individual because they're able to participate in the community and actually do something good for the community.
Okay, thank you. Yes.
My name is Doug Nichols. I'm a Republic Squad Coordinator. I spoke with you on the phone last week with some concerns. What I've done is myself and Robert Farrell, who's on Republic EMS, we've both been on for a number of years. We put together a proposal. It's just an idea to look at doing a partial paid system. I'm looking at the future of the county EMS, and as Don said, volunteers are getting scarce. And for whatever reason, busy schedules, just the next generation of people coming up aren't staying in the area, or they're just too busy with other things, or they're not willing to put the time in. So I don't know if you would like these.
Yeah, if you want to.
Yeah, I think to even kind of read that, so, or we'll be happy to read it, or however.
Well, what it is it's a 3-part. The top copy is a projection of what it would cost, what I'm estimating. I don't know what the total dollars are. The second page is questions about what expenses and revenues are, and the breakdown of the revenue from the runs based on Medicare, Medicaid, and private pay insurance, because that's important. And then the breakdown of the nursing home in Green Springs is I know we have a large number of runs there. The breakdown on those which are skilled versus non-skilled, because skilled patients would have to be billed directly to the nursing home, so we should be getting full reimbursement for those, whereas Medicare is going to give the Medicare rate for reimbursement. The last page is a projected, a possible schedule for a 12-hour shift, day shift, EMS, 2 squads on each side of the county, to put together a possible schedule to do that.
So I understand that this proposal would add about $986,000.
That's if you kept the Echo unit on at 70 to 7:30 on a 12-hour shift at night,
Okay.
1 unit.
So that is over and above what contribution level, what your budget is now.
And that's where I don't know where the budget, what the budget amount is at this time. That's what I came up with, the figure just for staffing and benefits.
Yeah, well, the budget right now does not include, since it is an all-volunteer basis, other than a few administrative positions, the budget does not account for any volunteer. Everything else is strictly volunteer. Is that correct?
We have
other than training.
We have a part-time paid Echo response vehicle that supplies 1 paramedic from the hours of 8 a.m. to 8 p.m. to end the squads when they get toned out. Like Baskin was out early this morning, and the Echo unit responded to that call.
Okay, so this, I guess what I'm trying to understand is,
Well, we're looking
with the current budget, that it seems to be sufficient to operate the unit excluding the volunteer issue. So.
The volunteer issue is the biggest issue
Yeah,
here.
oh, yeah, and is that this 986,000, is this taking just the volunteer issue?
Half a day probably.
That would be taking the volunteer issue out from 7A to 7:30P, and then keeping the volunteer squads in service from 7P to 7A.
So if we went with a partial paid EMS system, we would have added costs, bottom line, of 986,000. I'm just trying to get my hands around it. That's not 986,000 minus what we're doing right now. That is 986,000 plus what we're doing now. And again, I'm not finding any issues one way or other. The issue is, we'll have to do is we're going to find out how we're going to come up with it and how we're do it, if that's what the direction is of this board and so forth.
Does it
So I
change
understand
anything
that.
with the Echo unit though?
What my plan, my
Yeah.
proposal is it has the Echo unit staying on at night shift.
Oh, instead of using volunteers, then you'd still need that.
You'd still have the Echo to augment the volunteers at night.
Okay.
And if you look on that, on the one page there, it has a couple possible ideas for funding. I don't know if those are feasible or not with possible income tax or a sales tax. I know Commissioner Wagner had said that he thought we were maxed out on that.
We're at the state maximum on sales tax, and state law does not allow the commissioners to do an income tax either. It gives that a right to cities and perhaps villages, but the county does not have the option of an income tax. Sandusky County, as we talked on the phone, did a sales tax. They were at, I think, 1 1/4 or something like that when they put that on as, with a vote of the people, and that brought them to the max, I believe. So once you're at 1.5, the state does not allow you to go any higher. So unfortunately, it would probably have to be a property of some kind if it went that way.
What do you mean a property?
Property tax.
Property tax.
Unless there's some other creative way to do that, I have not really researched that. What is this, what are you proposing to pay the volunteer then, or
Well, they would be full-time employees for the county. You would have 2 crews, and I have the
they
salary
would be,
broken down there.
they would be full-time employees, okay. You said partial paid system, I was picturing what
Right,
Baskin
because it's a
did.
12-hour day shift coverage. And what my idea with this would be is to utilize the current squads that are out there, have 2 squads on each side of the county manned, and figure out a place to locate them in conjunction with where the squads are currently at, or determine where the best location would be.
Okay, an east squad and a west squad manned with paid people.
2 on each side, 12 hours each day.
12-hour periods, 7 days a week, or just?
7 days a week. Now, if it's feasible to cut that back, then that would be savings also, but I'm looking at the, I'm thinking out of the box here, trying to come up with an idea.
That would be my next question, is there a way that that it can be scaled back? And I understand the issue, I think I understand the issue. It's all got to do with the time available with volunteers. I mean, the time the volunteers have available, and it's because you also, the volunteers, besides volunteering their time for running EMS runs, they got an up to a 92-hour a year training session that they have to do grants.
Paramedics.
Yeah, so
Every 3 years.
that's
every
just,
3 years.
that's just the paramedics, or?
The EMTs have 40 hours. The
Okay.
advanced EMTs have 60 hours, and then the paramedic has
So
90.
there is a sizable commitment.
Correct.
And yes, there's some personal gratification in this whole thing, but how much is that worth, versus how much time you're spending?
And then you're proposing volunteers in the evening hours.
Correct.
Is your proposal, you and Mr. Carroll's proposal?
Correct.
Okay.
Have you run this by, I assume that the townships have a conglomerate meeting. Is this something that's been run by your group as a whole?
No. He presented that to me a week and a half ago about, he was going to bring that up today. There are several communities that I'm aware of, like Perhamville, Lucky, Macomb, they started as a part-time service, augmenting the volunteers. During the daytime, they'd be paid on station, at nighttime, they'd be available by regular pager call.
I guess my next question or suggestion would be for you guys to meet as a group, and right now, we've got a couple people that have bought into it. this is something that's gonna be bought in by all the county volunteers and by the EMS director. And to meet and see if this proposal is one that's bought into by the masses, and can it be scaled down and still achieve the goal? I mean, I hate to use the word, but half pregnant. I mean, can we get part of the process here without having the full burden there? So we look at a scaled down responsibility from the county, because then ultimately we got to figure out how we're going to come up with it and so forth. But sometimes it's easier to swallow at a lesser value than what that would be a sizable budgetary item for us. Sizable. Yes.
Harry Miller, Chief and Coordinator at Bass Fire and EMS. I've been working on with a proposal for the fire district and EMS district. The biggest thing is I see here is that the squads are owned by the county, the volunteers are operated by the trustees. In our situation, our EMTs are operated by the joint ambulance district. We're running 50+ calls more to cover the north end of the county because of Bettsville being out of service. We're housing 2 squads on a daily basis. I've been talking to Timberville, like Don has just said, of going part-time during the daytime from 8 to 5. It would be an on-call medic or an intermediate from 5 p.m. until 7 or 8 a.m. with a volunteer assisting the on-call people. I've talked to Kevin about it. We're scheduling a meeting between the 2 departments, probably in April, to bring this out front forth. I just see this county system starting to go downhill.
We don't want that, and that's absolutely
Right. Because it's getting harder and harder for the volunteers to come around. I mean, like Don said, we got 3 squads out today. I think they're pretty much out all week. We're getting squads that are getting phoned out 2 and 3 times for response. Nobody's answering. These are people's lives, property, and so on and so forth. And it's getting harder and harder to cover these county squads when people are working 2 and 3 jobs to try to make ends meet.
I mean, this is a good proposal. I mean, I understand that. Again, my feeling is so we get consensus from the whole group. We don't want to put a program together with Hopewell and it doesn't work for, Township B. To get something that works for the entire group and look at it as prudently as possible, as scaled down as possible, but still workable. And then come back with this is what we feel. We got everyone to agree on this. And this is really the minimum we can go and still achieve what we want to achieve with a combination private or partnership with volunteers and full-time employees. And this is something that we would propose and come back to the commissioners, and then it's going to be our responsibility to figure out how we're going to come up with the funds to take care of it. I mean, that would be my feeling.
Your thoughts are just a little bit different. You're proposing combining fire and EMS across county or just in your area?
It was just in our area.
Just in your area, okay.
Yeah.
But I agree with him, if we can do it countywide, that's fine. But we got 7 county squads. You're gonna put 2 county squads on each side. What 2 squads are you gonna pick?
Well, see, that's why I'm saying, for you guys to collectively come up with a proposal versus,
Yeah,
we're not versed on it as well as you guys are of the whole,
yeah.
whole part of the thing. For you guys to collectively come up with a countywide program that works, and however that is, I don't know your business as well as what you guys do. And again, scale it down to what can still be achievable and achieve the objectives we want, but hopefully scale the responsibility down. But we gotta have buy-in for everybody. I don't want to be in a position where I'm going to negotiate with each individual squad and we do this here and that there. Gotta have buy-in of the overall county.
And that's what it was once thought before, is getting rid of 3 of the county squads and just have 4 throughout the entire county. That was been talked about before. But then once again, what 3 county squads are you gonna get rid of? If we get rid of, I'm just saying, Nurgle or something. I mean, to me, that's a slap in their face. You got rid of their squad when their volunteers have done this for how many years?
Right.
And here we are, get rid of a county squad that is up and running.
Is there any economy of scales here? What I mean by there, if you eliminate, and I don't know how the revenue stream, is some of the revenue stream come from the township? Is there just an EMS facility that's being maintained and the cost of that if we did reduce some, that we could have some funds that are coming into those 7 squads, and now it goes into 4 squads, so now we can divide it into 4 versus 7. I mean, is that a possibility? And I know you may step on some toes here and so forth, but, shared services and economy of scales is the wave of the future. I mean, and I don't know how the whole revenue stream, Jeff, you may be able to elaborate on that.
Well, the revenue is what we have.
Yeah, but does any come from the townships?
No.
For your,
Well, how about
just
the
putting it in fire.
expense of operating the facility?
We give them $2,000 a year per squad to house the vehicles.
That's it? That's to run the electricity and the heat and
That's
rest-
our support through the LGF. The rest of it
Okay,
is on
but-
the township, because we have a contract that was signed back in 1978 when we started the EMS in Seneca County, that the townships would be, or the villages would be in charge of providing housing for that unit. And we're just supplementing their,
Okay, but there's a cost involved with that.
Correct.
There's a cost involved with that, so, I don't wanna be tarred and feathered here, but if you eliminated some of those, that cost may be parlayed into the pool, which now can be separated out into 4 versus 7.
correct.
So, okay, there's a $2,000, so if we eliminated 3 facilities, that would be a $6,000 savings, which to me doesn't warrant to do it, but if there's also a contribution from the townships of a much larger figure, now we got, again, I'm talking just for 50,000, that you now put that over into the 4 EMS pool, it may help offset some of these other costs, but that's something that, again, I'd ask for you guys to find out, what's the contribution to run that department from the township's standpoint? EMS contributes from the LGFI fund $2,000 to each
Correct.
facility, which is not a significant amount by any means, so I'm sure the facility costs more than that to operate them.
Do you have any more, Harry?
In the other situation, us at Bascom, we're an ambulance district over there. And we got revenue coming in to the EMS district itself. And so we're actually paying our EMTs a nominal fee to be sitting there. And that is paid by the Hopewell and Loudon townships.
Yeah.
And when we send a squad to Bettsville for a run, that's taken away from our response area.
And what is your reimbursement rate, or the rate that you give the folks for
It's
running?
$3.50 an hour is what we
When
give.
they're on call? Do you feel that would be enough to help? If we could do that countywide, would that be enough to?
I think it should be more. That $3.50 don't even get their gas anymore. Because, gas is now $3.88. And if we have EMTs coming out to the station and setting for 2 hours, they're only making $7.
Yeah.
And we got people coming from Tiffin, Fostoria. We got a good selection, but some of these individuals are running from Tiffin to come out to the station and set because they live outside of that 5-mile radius to where they gotta come to the station and set. So, I think we got a good system, but I think it needs to be a little bit improved a little bit more. I think the whole countywide system needs to be looked at, because the volunteers they're here 1 or 2 years and they're gone.
Yeah.
It's a stepping stone. They move on to something else, or they let their cards drop, or they see a bad wreck or have a bad run, and they're done. You'll never see them again. So, and we're trying to do our best to help everybody out on the west side. They've been really good to us. Bascom went through this years ago. We were out of service. We're out of service 24 hours a day, 7 days a week. New Riggle and Bettsville both stepped up, took care of us. Now, we're returning the favor to them, but after a while, the EMTs are getting tired.
Sure.
I don't want to burn my EMTs out, but at least they're coming and saying, look, it's patient care, it's top priority, patient care. And that's what they're doing. So, we got a good working relationship with Nurigal and never had an issue, and I think we just need to change some things and try to make it better if it's possible, or put a levy on, or we even talked about maybe getting with Nurigal and see what we could do to assist them, and however it was, so.
Are any of the other ones districts like yours? Yeah, I didn't think so. Okay. And Doug, you had, with this idea that you presented, do you think, what's the probability of being able, if money wasn't an issue, we know that it is, but would you have the 8 people you needed in the locations you needed them, or I guess it wouldn't matter because they'd physically be there on their shift, so it wouldn't be the travel.
You would have them already on duty and staffing a squad, so they would be there to respond immediately versus now with the volunteer system, we get paged out. At Republic, we get paged out, we come from our homes or wherever we're at in the locality and come to the station. We have 5 minutes to get there, or they drop our tones again. And then after that, when we respond then, we've already got a 5-minute delay there at least in getting to the patient. It's gonna, something like this, you're gonna have full-time employees, so you're gonna be able to hire people that are qualified and willing to do this, and you're gonna give them some benefits to hang their hat on as well, so.
And would you be able to get enough people that would want, I mean, averaging, let's say, $20,000 a year is what you've got in this?
Well, what we base that off of is what the current ECHO paramedics are being paid, and we scaled it back from there with the different pay levels. I don't know if, you know, once again, this is just an idea put on paper so that it can be visualized, so that it can be developed from there.
I think it's a good starting point. But we need to have buy-in, I'm just repeating myself, buy-in of all the EMS and the director, and to make sure that it's nailed down to what is lowest cost and still achieves the goal. What we want is to offer a quality EMS service in Seneca County. We can achieve those goals, and then from then it's up for us to figure out how we're gonna come up with the funds, but everyone's gotta do their job in this to make it happen. We hear you loud and clear. We don't wanna sacrifice quality EMS service in Seneca County.
How about some of the other squads, any? Let me get to the squads first, if I could, Delmer. I'll get you in a minute.
Russ Rogers from Green Springs.
Yeah.
We've got I don't know, maybe a little different situation over there with the Elmwood facilities in Green Springs. They pretty much, you know, we've got several buildings over there with Elmwood. And in the past, I know we had several years ago when St. Francis was sold to Elmwood, they gave us a small amount of money through the sale of that. And I actually used that money to help fund some basic classes, to get some other EMTs in there. And like I say, and that's been several years ago. Now, like Harry says, you know, after a couple years, you know, you have a big turnaround on EMTs. And I'm back in the same situation again that I was prior to those, to that funding to get those other EMTs in place. I like both Doug and Harry's proposals. I haven't seen them on paper yet, but Fred's got a good idea. You know, we need to get to our group together to go over these things and better come back with you guys on a good proposal. You know, something that'll work for all of us.
Okay.
But you know, it's getting harder and harder. And like Doug says, during the daytime is the toughest time. In my roster over in Green Springs, you know, the majority of our people right now, they all work days, so it's hard to fill those. And we're seeing out of service times now back again in Green Springs. And with us with the facilities over there at Elmwood, you know, we get quite a number of calls through for those facilities over there.
And then that stresses the neighboring, stresses Republic and some of the others that have.
Yeah,
to
if they
come
have,
over there.
then, you know, a lot of times we'll, being as it is right in Green Springs, and actually a lot of the Elmwood facilities are in Sandusky County.
Okay.
So a lot of times, if we're out of service, it's a lot quicker for the dispatchers to go ahead and call in a Sandusky County Life Squad unit to come to Green Springs.
Okay.
I would ask though, and I know it's a tough subject, but when you get all 7 EMS groups together and look at the economy of scales, if you reduced a couple of those, and what kind of funds could be put back in the pool? I know it's a tough one, but maybe it's a significant amount for the town, the townships, and this $6,000 we would throw in it. I mean, it's gotta be significant, it's gotta be much more than that, but, I mean, we need to uncover all rocks when we look at it, and it may not be advisable to everybody, but still keep the quality of the EMS up in the air. I would just ask that you look at that and have a figure on that.
I think the township, and I don't want to speak, I think the township contribution is strictly in kind, and they don't give you any cash. They may have in-kind contribution of facility or something.
Yeah, but they gotta maintain that facility, and of course, the question would be is if they did away with it, well, they still got to have some kind of maintenance, heat and electrical, so it may not be significant. I don't know, I don't know. But again, it's just a rock that needs to be turned as we investigate a long-term. This really, what we're talking about is a long-term solution for EMS in Seneca County. The solution that has worked for years is not adequate to support what is needed today, is what I'm hearing from you guys. So, the time to turn the stones and see what we can come up with.
Add anything to that, Russ?
No. Yeah. It's, you know, like I say, it's tough, and myself, I hate to see us out of service.
Yeah, yeah.
You know, I've been on this for quite a number of years, and, you know, it's tough seeing this squad out of service, any of the squads out of service.
Yeah.
It's one of those things, the first time someone has a heart attack and we're not there on time,
Right.
that loved one, I mean, it's gonna be a major, major issue. We wanna make sure that doesn't happen. Because then it's after the fact, and it's not necessary. I hear you.
Okay. Other squads wanna say anything? Hey, Delmer?
Yeah, I was gonna question, when I came in here, and this might fall in with this a little bit, is there any forecast on what the sales tax is gonna be for the county this year?
Well,
Is there gonna be any kind of an increase? It could be
It's up just
contributed
a little
toward it.
bit. It was up like, I think, 3% last month. It's not significant, but it's, you know,
Yeah.
it's tracking well.
Julie said we're up again this month too. I just spoke with her yesterday,
Okay.
so things are looking good. People are spending.
Yeah, well, that's what I was wondering,
It's
if
not
some
close
of
to
the-
the
if some of this
890,000.
extra money could be directed toward, you know, this problem.
Yeah.
I was wondering about the tax revenue when I came in here, and this almost seems to fit the tax revenue and the need for it, you know.
The problem
So I
with
would say-
earmarking the tax revenue is we need something for EMS long-term,
Yeah, that's,
a long-term solution, and income tax is a fluctuation thing. I mean, it's the
Yeah.
commissioners and I, we've spoken many times.
yeah.
A couple things that I learn in business, and I watch a couple things in a county. One is income tax, and the next one is revenue from ICE, because those are the two variables. Property tax and so forth, those run pretty constant. And those are the some of the two largest revenue sharing items, revenue generating items we have in the county. And those are the ones that are the most volatile.
Yeah.
So,
It's true.
I mean, I hear you, but
Yeah.
I'd be just scared the bejeebies to attach something on to support EMS through sales tax.
Well, I was wondering about what the increase was, and I thought, well, we get a big increase here, we could direct it that way.
We can be assured it's gonna come year after year.
ICE is the prisoners we house, for those of you that didn't realize what ICE stood for. Okay, anyone else? This is your chance. We may not get together, we don't get together like this very often, so.
This is exactly what we want a work session for, it's give and take. There's no right or wrong answer, but we have community members all together, and let's try to come up with a solution to problems, and it certainly is a problem. We appreciate your input.
I don't know if Harry wants to help me out, but remember one of the previous commissioners was meeting with some of the fire chiefs and some of the coordinators. I think he started with the fire chiefs and going with the coordinators to talk about, because of the way the county's funding was going downhill, he was, one of the previous commissioners were trying to meet with them, looking to maybe create a joint county district for all of the, you know, villages and townships doing and getting, basically getting the county out of it. Maybe doing, and I think they had talked about, you know, all the supplies and everything we currently have, giving it to some sort of donation, pending anything legal, to that district to get them running, to get them started. And then, but that would end up having to go towards some sort of a local, each of the townships, villages would have to put on their local,
Levies or
Yeah.
so forth.
Right, Stacy's right. I mean, it was talked about last year, a year or so ago. It'd be like Bascom Joint Fire, Bascom Joint EMS, they would be combined. It'd be Bascom Joint Fire and EMS District, AVR, which is Attica. Attica EMS could jump into AVR's area. Attica Squad would be taken over by Attica Fire. New Riggle could jump into MDS's, which is New Riggle, Big Springs, and Seneca. That squad would be taken over by the fire department, still ran by the volunteers or whatever have you, just like we're talking on a levee with Hopewell and Loudon, and have it set up that way. The Bettsville situation, I don't know about that up that way to create a district. The Green Springs area, not sure about a district up there. The Republic area, not sure, Bloomville. So maybe that's something where they could combine squads, departments or something like that.
That will be the kind of input that we would ask for you to come back after getting together with the 7 squads, with the EMS director, and coming up with a proposal. If it's I call it privatizing, but it's not.
Right.
Put it over to the township.
Right.
You know, how do you want, what works best for you guys?
Yeah.
And that's, again, that's the kind of input that I
That's
think that,
where I have talked to Stacy a couple times, and she's been a big help. I mean, the squads are owned by the county. Is there a chance to buy these squads if we decide to do this? And then have to come back to you folks and say, you're gonna get out of the EMS business, this is what's gonna happen. We're gonna sell the squads to the local departments that have them now, and let it go at that. Then it'll be just.
can we legally do that? Are we?
if they do a district.
We are not mandated to provide EMS.
Or-
services. We
okay,
could- we
then
could
that's an
drop it
option
tomorrow.
that it certainly exists then.
I mean, it's certainly something we want to provide, but
Absolutely.
we're not mandated to provide
Correct.
it. Which seems kind of odd, we're mandated to do a bunch of stupid stuff.
That's why I asked that question. What we can and cannot do.
Okay, Kevin, you had something?
I'm Kevin Reinhardt, I'm a Loudon Township trustee, I also sit on the Bascom Joint Ambulance District. I've been in this, I don't know, since 2001 or 2002, not as long as some of the EMTs. And the personnel thing's always been an issue, you know, each squad goes through their phases, they do good, then they fall off, they do, you know. And things are only getting tougher with personnel, everybody's got more responsibilities, and these guys work full-time jobs, plus they're going out there making these runs in the middle of the night and that stuff. You just can't imagine some of the, what they do and stuff. And you think about it sometimes when you wake up all of a sudden, you hear that siren going off, you think, man, you guys are out there doing a good job. So it is a big issue. It's like Fred said, we need to all get together. We really need to start looking at this. We've been kind of letting it go, and we got to sit down, check it out, see what we can do. And everybody's got to get together. But a lot of the population probably doesn't know. You know what goes on behind. That's a lot of the issue right there. A lot of the trustees maybe don't even know about what's going on.
Yeah.
So it all has to be kind of an education thing there too. And, like you said, we do need to sit down. We really need to start looking at this.
And we will help facilitate anything that you need. But we need input. However we can help.
Go. How does a private system work, just for my education, like what's the name of that private, a for-profit?
Shasta.
North Star or?
North Star.
Lifestar, North Central EMS
How
MedCorps.
do they work? Do they just run off of, do you just turn an area over to them and they run off of the
It's by
medicated
contracted services, correct.
area? Okay.
But their bottom line is, it's for profit.
Okay.
And I've worked for a private ambulance that was covering a 911 district, and we were pulled out of the area to do a private run, and by the time they got somebody else to cover our area, it was like 45 minutes. They're totally gone.
Okay.
So there's some operational needs that would need to be addressed if that would have to be a system.
Okay, so the quality is maybe not there in a private.
There's good
for-profit.
EMTs and paramedics out there. It's just the operational, the bottom line is for profit.
Response time might not be.
Yeah, the response time
not knowing the area,
Okay.
that's a big thing.
We've had that already with Stop Check Ambulance on Marion.
Stop
Back-
Check, that's
back-
what I was trying to
Back in the
think of, Stop
nineties, they had people from out of the area responding to a 911 call, could not find a gunshot wound, person in the middle of the woods. And they didn't have a map inside the rig for Seneca County, weren't familiar with the roads. And it was, Republic ended up having to take care of them. And got dispatched all along with it because their response time was so horrible.
Is Tiffin City privatized, or is that run through the fire
Full
department?
paid system by the city.
Is it?
Well, it's
Okay.
Fostoria.
Okay. Same with Fostoria.
Yeah. Anybody else want to comment on this issue? Okay. I think what I'm hearing over and over again is that the volunteers, getting volunteers is the problem. And I think Fred kind of said it, that we're all thinking it can't continue the way it is permanently. We're going to have to change something. I think Fred said it, that if the coordinators could get together and say, we want to do this, I think we would take your cue. Now, if that involves, and I don't want to, you guys tell me if I'm wrong here, if that involves some sort of a levy proposal, because our budget is what our budget is, we don't have 800,000 sitting around. If that involves a levy proposal, we would certainly, I think, support that. But I don't know that we could sell it, you know. We'd have to sell it as a group. We could work on it, and then you have to work on it in the communities. I think whatever direction the coordinators want EMS to go is the direction we want it to go. Is that
Yeah,
correct?
I would agree
Right.
with that. I would agree with that.
So if you guys can come together and get a consensus of, we want to go to this certain system, take your time, you know, whenever you can come up with that, and come back and present it to us, I would pretty much guarantee the board will run with that. Is that-
Just hone those figures down to what will be effective and the least amount of cost as possible. That's gonna be easier to sell this thing. Or perhaps come up with the funds without having to put additional taxes. I mean, the lower the price tag with the thing, the easier it's gonna be to swallow for everybody. And my last resort would be to go back to the citizens on a levy. That's my last resort, and maybe that's the only option, but that's why I ask, really pencil those numbers in, sharpen them up, but still be effective.
And you gotta think fairly long-term, too. You know,
Yeah,
make something that
absolutely.
just works for 2 years.
Yeah.
Is that fair? Is that workable with you folks? Okay, and I know you have a meeting this afternoon or sometime today, I think. Is that correct?
They have one, yeah, they're
They
gonna
do.
just do it
Yeah.
after this session, they're
Okay.
gonna do it back in our back
Okay,
room.
okay. All right, come back whenever you get that. You can bring the whole group back, or you can send 1 or 2 people, whatever you wish. Okay, anything else for the work session on a different topic that somebody needs to bring up? Okay, thank you very much for coming. We appreciate that. We will go into our formal meeting, and you folks are free to leave, or you can stay, whichever you prefer to do.
Thank you.
Yeah,
Thanks. Thanks, guys. Come up with solutions. Yeah, come up with solutions.
I have no idea.
That's right. It's gonna get tough enough.
So I'm just wondering who was it?
Yeah, here, there's a few that I don't
Yeah,
know.
I believe
that
it
don't
is
come
too.
to the meetings.
I just wanted to
Yeah.
preface that.
Yeah.
So that if she's,
Just
she's
sharpen
not,
that pencil as much as possible.
right?
Because Attica should have.
All right,
been-
let's call this regular meeting to order, March 19th, 2013 at 10:15. And we'll begin with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, roll call, please. I'm here.
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 And we will sign the journal, and is there a motion to approve the minutes?
I'll make a motion to approve the minutes as outlined.
Okay.
Second.
Any discussion? Vote, please.
Commissioner Fuller,
Yes.
Commissioner Stacy,
Yes.
Commissioner Redpath.
Yes. Okay, old business, Mrs. Wilson.
Old business, I did receive confirmation from Jason Varney that they are officially moving to a new location. Our current lease, as you know, says they have to give 60 days notice, which they have sent me that, did they send Friday? And he called, talked to me prior, and was asking if the 60 days would put it to May 13th. If they were out by the end of April, not in that building in May, if we would not force them to pay for that prorated part of May. Knowing we have somebody willingly going to be actively moving into that area. I told him I didn't think it would have a problem with that, but I would talk to the board before, and then I would comment in writing back to him, so he would know for sure. But, I mean, we have somebody, Tanya and Nikki are working on the lease for FSA, including that area now, and they want that actively done by May 1st. So that would be almost perfect timing, is that they said they would be out by the end of April and FSA would be
So the
moving
new
in.
tenants would start paying rent as of May 1st?
Correct.
So we're gonna let the one out 13 days ahead, but the other ones are gonna start paying 13 days ahead. So the net for the county is,
Yeah,
See,
it wouldn't
yeah.
be.
Yep,
I just
I'm
wanna make
fine.
sure that was
That's
okay.
fine.
Yep, yep.
Okay.
Thank you.
Other old business, Nikki, do you have that information? I'll let you go over it for favors.
I have it, but I sent the resolution to Amy to see if
Okay.
it was right. But we can do this and I'll just do it retroactive if you want to.
Derek said we didn't absolutely need to do it today,
Okay.
so we can well
We'll
wait.
just wait till next.
Okay. That's all I have.
That's all you have, Nicole, anything else?
No, I got asked a question last night at Green Springs about regional planning, and so Fred, I told him I would pass it on to you, and they were just asking if there was any further discussion on any changes or anything with regional planning and the merger of anything with SIDEC. And I explained to him that probably the exec committee was probably continuing those discussions, and we haven't had a regular regional planning meeting.
the executive committee for regional planning has come up with a lot of issues why SIDEC and regional planning should not be combined, so we tabled that till next year. That was just kind of the direction for some of the executive members in that. We are progressing very actively with it. The transportation, highway transportation subcommittee for regional planning has set as the two priorities is the access road to combine 53 with 18, and the other one is to take care of the safety issues on South 53. Those are the two primary objectives in regional planning. And then we're assessing some of the responsibilities and maybe redirecting some of the grant writing and so forth within regional planning. And Jill's coming up with an outline of duties and responsibilities and so forth. But other than that, that's about where we stand at from regional planning.
Okay. Anything else, old?
No, not that I can think of.
Okay, old business?
Wait, hold on.
Oh, good.
I got a call yesterday, and I forget the man's name, I have it written down. Wanted to know if there was any more information on the job fair stuff. You guys had a date on when, I think he was somebody that was going to attend the meeting.
Okay, well, I'd be glad to discuss it, right now, that I guess we can do it in this forum. But we will be having a jobs fair in Seneca County. We're having it at the Heminger Center, and that will be on May 13th. We're doing this in conjunction with Congressman Jordan, and we look at the objectives of the job fair as kind of a threefold process. One is to connect employers with employees. There's roughly 400 and some jobs currently available in Seneca County, factory paying, decent paying jobs that are available right now. So we're going to connect those employers and employees together. We hope to have in excess of 20 employers exhibiting at the job fair. I would hope that we can get in excess of 500 people that are coming to be at the jobs fair with the exposure of the congressman and being able to elevate this thing at a much higher level. We hope to get press from Toledo. And the second part of the jobs fair is really to educate the people in Seneca County and throughout Northwest Ohio. Seneca County is open for business, it's growing, it's thriving, it's employing people, it's doing all those things that a good, successful operation needs to do. And thirdly, and that's where I had the meeting this morning out to Norcog, out there, I call it the old Kroger building, I'm sorry, I'm an old-fashioned guy, where we're trying to, we're seeing if we can get the county school administrators involved with the process. The way we look at it, we're all dressed up, we've got everyone there, we've got the venue, President Marion has allowed us graciously to use the Heminger Center, everything's fine. Why don't we invite the juniors and seniors of Seneca County into this jobs fair, not to apply for jobs, but to have the exposure of the various employers and be able to interact with them. In the process, the thought is that we will also have a mini symposium, like a Q&A answer. Get a couple, 3, 4 high-profile employers in this county. Dr. Lahosky has agreed to be a facilitator where we're going to do a Q&A thing, talking about the importance of work ethics in the jobs, talking about the importance of not doing drugs and to continue with the job, and kind of some fundamental things. We're going to have Owens, TerraTech, and Sentinel there as vocational schools, so that as these potential employees interact with the employers and they find out there's certain job skills, like maybe a welder or whatever the situation, and if they don't have those skills, they can walk right around the corner to one of these vocational schools and sign up for classes to be able to give them the skills so they can work these jobs. And on top of that, we've got the 2 universities that has allowed to provide a professor, that we're going to have classrooms in the Heminger Center that's going to be devoted to some very simplistic things. Is how do you conduct yourself in an interview? How do you fill out an online application? And maybe some other issues. Job and Family Services will also be there trying to help individuals. So we want, again, the threefold, I'm repeating myself, but the threefold process we're trying to do is A, connect employers with employees. 2, to really promote Seneca County, that it's alive and well and growing. 3, we're hopeful that we can bring in area youth through the schools on an abbreviated session. This is going to be May 13th. It's going to be from 12 to 6, but we're going to invite the students in only from 12 to 2:30, and to do this whole process. So it's a very ambitious process. We've got Fostoria, Tiffin, we've got the mayors, the economic development people, the chambers. We got assistance from the Congressman Jordan and his office and staff that can help us in a lot of the PR. We want to make this a big thing and really get some exposure in this whole process. So I'm pretty excited about it, and the commissioners have been involved with this thing from the beginning. When Holly and I were down in January, when Congressman Jordan, we were down, we had a meeting at the mayor's office. I think Commissioner Wagner, you were there too. He's the one that's kind of initiated this, and we're just taking it off, and there's a lot that's got to happen in a short period of time. The reason May 13th is that the congressman can give us the whole day there and to kind of elevate the thing. He's also, the congressman will be in Tiffin and in Fostoria August 4th. April 4th, touring various manufacturing facilities and promoting jobs that are available and so forth. We hope to get him back again sometime in late April, again, just to hype this whole thing up. And I'm pleased at what we're doing, and I think it's a very positive thing, and so that's the update on that.
All right, new business.
New business, I have bill vouchers 35 and 36. I have a resolution authorizing a fund transfer to be made to the bond retirement fund, 310, moving $400,792.22 from the general funds transfers out to our bond retirement fund transfers in on 310. This is money we've already set aside in the general fund for our bond payment, and a lot of times, just administratively, we end up waiting till the last minute to transfer this because it sometimes gets forgot till the end of the year, so she must be just trying to get it moved in ahead of the game.
Do we have the cash balance to do that right now?
To transfer that, yes.
Yeah, we do?
Yep,
Okay.
yep.
Do we, what is the balance on our bonds that are out there?
I can't tell you the, oh, go ahead.
It was, I'm thinking it was like 1.9,
Is that total bonds?
just for bonds.
Yeah, total bonds that the county has to retire. There's
Yeah.
only 1 point?
Um,
No, it's a little more.
Is it 2
Yeah, I
point?
heard four, through the campaign,
I think
4 or 5.
I think our total debt is 4 something,
Okay.
isn't it?
That
Total
seems a
debt,
little
is that
high.
bonds
I'll
and
check.
borrowing, or is it all bonds, or?
It's mostly bond. We have a note also.
Yeah, that's only down to,
That's pretty
Couple
small.
hundred,
Yeah, that's pretty
300,000.
small. Most of it's the bond.
I'll
Uh,
double check.
I
but
can tell
thought
you
it
the
was-
payments go, they're about 540, 550, 560, mid 500s through 2018. And then,
What's this 400 here?
well,
Because we already have some in
we
the
have some
fund.
in there, that's right. We didn't have to move the whole thing.
Okay.
And then in 2018, it drops down significantly to like 150 or something like that. And you pay that through 23. So we paid off in 23 at the current rate. But it's pretty high until through 2018. It's gotta be up around at 4 million total.
I'll check again.
How are we rated? I assume municipalities are rated, how is our
Yeah,
rating
we're
on
rated.
bond? Are we good, bad?
We're good.
I thought it was good. I mean,
Yeah.
I can't, it's been a while since.
They've
we've
like
talked
got,
about
they've
that
got an
with the
A, double A,
budget
triple A,
Yeah, I can't tell you.
B, double
Yeah.
B, triple B, and we're in
Hopefully,
the
we're better
A's.
than the federal
Yeah.
government.
We're in the A's.
So,
Yeah, we're very well
Okay.
secure as far as that, because I can't tell you the
Yeah.
exact rating. Maybe Loretta remembers.
When Katie Kleinfelder was
Uh-huh,
here
uh-huh.
about a year ago, she said the rating was excellent. I
Okay.
don't remember A, B, we know
Yeah.
whatever
yeah, I
it
remember the
was,
number,
but
but
she
I don't
said
remember the
we were in a
discussion.
We
fine
just need to keep
position
away
to
from the
borrow.
feds. They'll drag us down.
She's the money person
Yeah.
Yep,
out of Cincinnati, I believe.
Yeah.
Whatever.
yep.
Used to work for Season Good and Mayor, and they call it something else now. I don't know what they call it now.
Yeah.
That's, okay, you're, that the answer to your question?
I'll
Okay.
get your answer.
Okay.
I have a resolution authorizing a fund transfer be made to the note retirement fund, 312. This is moving 44,000 from our notes transfers out to the 312 note retirement fund, transfers in for 44,000. I have a resolution setting time, date, and place to receive sealed bids for the Seneca County Road 14-1.69 superstructure replacement pre-stressed box beams. The date is Tuesday, April 9th at 10:30 a.m. here at the Seneca County Commissioner's Office. I have a resolution authorizing the Fair Housing Program Agreement with WSOS. I have a resolution authorizing the agreement with Rents and Associates for the Tier 1 assessments of former underground storage tank system on behalf of the Seneca County Engineer. I have a resolution authorizing the President of the Board, Jeffrey B. Wagner, to sign the Office of Criminal Justice Service subgrant application on behalf of the Seneca County Sheriff's Office, retroactive to March 18th, 2013. And I have a proclamation. I'll wait and read that when you're done.
Okay, is there a motion to accept these? Motion?
Yeah, I just gotta make a statement. This thing with the Seneca County engineers, just so everybody understands, when there was some work done, some underground storage, it was all approved by whatever government agency and everything was fine, done 10 years ago. all of a sudden they go through the paperwork from 10 years ago and find out that something didn't look right in the paperwork, so now they're making us spend all this money again to recertify it. I mean, it's just insane, but
Yep.
I don't know, I just want to get at it, just,
Is that a motion?
Is that a motion to accept all these?
Yeah, yeah.
If that was-
reluctantly.
I'll second.
All right. All right. Any more discussion? Okay, roll call vote, please.
Commissioner Zoller?
Yes.
Commissioner Stacy?
Yes.
Commissioner Wagner?
Yes. Okay, other new business.
I do want to say
Oh,
that,
yes.
that Mark, Mr. Zimmerman is volunteered to help cover that, so it's not coming out of the general fund. Mark, being it was his, not necessarily his tanks, they were the county's tanks years and years ago, so he's done us a great favor taking care of this in both aspects. I know it doesn't seem to be
Yeah, it's not right,
right,
but that's
but
the law.
he's helped us out. Okay, I do have a proclamation. Whereas Seneca County prides itself on giving back to the community, contributing to the quality of life amongst our citizens, whereas the following organizations are working collaboratively to help increase community awareness of child abuse and neglect in Seneca County. These organizations are the Seneca County Department of Job and Family Services, CASA, and the Family and Children's First Council. And whereas 390 cases of child abuse and neglect were investigated in Seneca County in 2012, and whereas through a national effort, citizens of Seneca County are encouraged to join together to raise awareness for those children fallen victim to abuse and neglect throughout the month of April. Whereas this effort will give abused and neglected children in our community and across the country a chance for a safe and positive future. Now therefore be it resolved that we, the Board of Commissioners, Seneca County, Ohio, do hereby proclaim April 2013 as Child Abuse Prevention and Awareness Month in this county, and in doing so, urge all citizens to join in the national effort to raise awareness and help prevent child abuse and neglect.
Thank you.
392 cases.
In Seneca County. Yeah.
Any other new business?
Nope.
Okay. Nicole? Mr. Zoller? Okay. Couple things, I will remind everybody that next Tuesday's meeting is an evening meeting in Fostoria. So if you show up here next Tuesday at 10, you're welcome to come, but we won't be meeting. So Tuesday evening, Fostoria, was at 7 or 7:30?
7 at the municipal
Yes.
City building.
city
yeah.
building.
Yep.
City building. It said 7, oh, not 7:30.
Right.
The calendar to make sure. For some reason I was thinking 7:30.
Yeah, I was thinking 7:30 also.
I thought our calendar said 7, but I
We
don't
better,
think I
we
will.
better check here to be sure.
Yeah, I have 7.
I have 7:30.
Okay.
But it is 7? Well,
7:30 is what the resolution says.
Okay,
Okay, well,
yeah,
we
so
better-
7:30 on the calendar too.
it's important we get it in the Fostoria paper at the right time. So what is the right time? So this young
7:30.
7:30?
If the resolution says 7:30, which is what we passed at the beginning of the
Okay.
year, we ought to stick with what our resolution says.
7:30.
And Nikki did verify with them last week that it is on their schedule
Good.
and the room is available.
Yeah,
so.
there was an article in the paper, it sounded like they
It
were
was like
looking
front
forward
page
to
coverage on this.
it. Okay, we do have a bid opening. I almost forgot about our bid opening for a household sewage treatment system. Cindy, do you have anything to say about that before?
This is the last system to be bid on the 2011 year program monies. So we will be done with 11, and right now the 2013 program is under comment with Ohio EPA ending, I do believe, Friday. It was either last Friday or this Friday. I'm getting my Fridays mixed. We'll have the final details of what the requirements will be based on the comment period. But right now it looks like that if there's no impact from the federal sequestration, it looks like the county will receive $56,000 for the 13 year, which equals about 3 to 4 systems.
Okay, for a newbie,
Yes.
what is this?
This is a low-income home sewage treatment replacement program.
Septic tank.
Septic systems that have failed. They have the homeowner can either be 100% poverty level and receive one or lower, and they would receive 100% of the funding to replace the system. Or if they are between 100 to 200% of the poverty level listed in the program, then they would receive 85% and they would have to pay 15%.
This administered by the EPA or the health department?
It's administered, I have a contract and we'll be working through the contract for 13, but for the 11 program, I've been administering on behalf of the county commissioners because the money's come through the county as a principal forgiveness loan. And I've done that through the Sandusky River Watershed Coalition as WSOS. And we would entertain doing that again since I made application on their behalf last fall. There was a resolution passed to submit an application. So I usually don't enter a contract unless we know that funding is actually coming. So we should be nearing that very soon. And we already are receiving interested people on a list. So we have a waiting list as well as the health department's list of people that are under order. So one way or another, that money will be spent. I'm almost positive.
All right, and we're ready to open bids.
I have one bid. This is for a property out on State Route 635. Do you happen to have the engineer's estimate for that one?
$13,500.
Thank you. The bid is from A&D Excavating LLC out of New Regal, Ohio. Their total bid amount is $9,525, and their bid guarantee and contract bond is included. And that's the only one I have.
All right, we will let Cindy have that bid to review and make a recommendation to us whether we should accept it or not.
Right. It'll go through Ohio EPA to review from their program standpoint. So I will let you know.
Thank you. Public comment?
I'm curious what that dollar number is that has to be spent at the engineer's office because of the buster people.
I'm not sure if there is a dollar amount yet, is
I
there?
don't think
Oh, okay,
it's
it's
in
just fixed whatever.
Uh,
I'm just curious.
Renz and Associates doesn't actually do the work, they do the testing.
Oh, okay.
So they'll do the testing and then
Okay,
determine what
testing costs money, though, right?
testing costs.
That was 10 grand, wasn't it? Or-
Was it?
I don't, because Mark, I think, will probably do most of the actual digging. They did the digging the first time they went through that, so I'm gonna assume that labor cost will be absorbed by the engineer, but as for all the testing, I don't remember seeing an amount yet.
Yeah, I don't
I know
think
Mark
there's an
was
amount
working with them.
associated with that. Renz has been very good to us as far as testing over here and they've done all their testing, haven't they?
Yes.
But to think this is something that passed 10 years ago. They were never out to not out to re-inspect it, that isn't what brought it up. Just they re-looked at the paperwork.
In other words, trying to find a source of income.
Yeah.
And I hear that.
For them.
I hear that, that's right. If they find this, then they justify their jobs, and it's
Well,
like,
these fines, these horrible fines that they
oh,
assess.
God.
Yeah. Yeah, and we could have been liable for $500,000 if we did not reply in a certain amount of time.
Right,
It's
right.
unbelievable.
To me, that's bureaucracy at that work.
Yeah, I think Renz will test, I'm not 100% sure, I think they'll test, and then Mark will dig out to where it tests clean, they'll test again until it tests clean. So hopefully we can get by without too many dollars there. To be seen. Other public comment? Okay, if there's nothing else, I would like to go into a brief executive session to discuss personnel, if it's okay with the board. So I need a motion to do that.
So moved.
Seconded?
Okay, roll call, please.
Commissioner Zoller?
Yes.
Commissioner Stacy?
Yes.
Commissioner White?
Yes. Give me a couple minutes.
You gonna take any action after?
No.
Okay.
Remember, front page coverage for the meeting. I mean, I can take it.
Yeah, and
Oh, well, you got somebody to fill in? Well, sure.